Hello, fellas. How are you doing? I hope you are happy and healthy. Let's enjoy Dr. Y chest radiology. I'm Dr. Y, medical professor, chest radiologist in Seoul, Korea. Today, we're going to talk about acute respiratory distress syndrome, ARDS, chest radiologic and CATscan findings of ARDS. White, not black. Let's go. Before starting the museum tour of chest radiology of ARDS, we're going to review about ARDS. ARDS is a type of respiratory failure. It's a respiratory failure characterized by rapid onset of widespread inflammation of the lungs. Symptoms include dyspnea, tachypnea, and bluish skin coloration. For those who survive, a decreased quality of life is common. In medicine, failure means the organ cannot do its own work, own job, failed to do its own work. So, lung failure means lung cannot able to gas exchange. Heart failure means heart cannot pump out the blood. Hepatic failure means liver cannot detoxify, cannot synthesize the proteins. Renal failure means cannot filter the blood. So, the last feature of human is multi-organ failure, usually the multi-organ failure. And one of the most significant feature is lung failure, the ARDS. So the radiologic findings of ARDS is very sad story. What is the causes of the ARDS? There are too many causes. A. Direct lung sources, direct injury from the lung. Most common thing is pneumonia from bacteria or viral origin. And then aspiration, inhalation, lung injury, lung contusion, chest trauma, near drowning, etc. And B. Indirect causes. That's response to systemic injury. Number one is the sepsis and shock, pancreatitis, trauma, the fat embolism, cardiopulmonary bypass, trauma, burn, increased intracranial pressure. Pathophysiology, a form of fluid accumulation in alveoli of the lungs, not explained by heart failure, typically provoked by acute lung injury that results in flooding, leading to non-cardiogenic pulmonary edema and decreased arterial oxygenation. Additional common findings are partial collapse of the alveoli, low level of O2 in blood, that is hypoxemia. Pathology most commonly associated with ARDS is DAD, diffuse alveolar damage, which is characterized by a diffuse inflammation of the lung tissue. Diagnostic criteria of ARDS. It was year 2012 in Berlin. They defined the ARDS. Number one, lung injury of acute onset, less than 1 week of an apparent clinical insult and with progression of respiratory symptoms. 2. Bilateral opacity on chest X-ray, not explained by other lung pathology. 3. Respiratory failure, not from heart failure, not from volume overload. 4. Decreased PaO2 over FiO2 ratio, that indicates reduced arterial out from available inhaled gas. Categories of ARDS, which means degrees of hypoxemia, that is decreased PaO2 over FiO2, partial arterial pressure of O2 over inspired O2. The mild degree is less than 300 mm mercury. That is also called as acute lung injury, ALI. Moderate degree is less than 200 mm mercury. Severe degree is less than 100 mm mercury. Chest X-ray findings of ALDS are not specific, non-specific findings. They just described as bilateral opacity on chest X-ray at Berlin in year 2012. It may resemble typical bilateral pulmonary edema or pulmonary hemorrhage, diffuse bilateral coalescent opacities, usually in 12 to 24 hours after insert as a result of proteinaceous interstitial edema. In contrast to cardiogenic edema, ALDS persists for days to weeks. Chest CATscan findings of early stage. CT appearances can be variable, not specific, just like the chest X-ray shows. Some people may show complete resolution. They are lucky, very lucky. They are not so common. Coarse reticular pattern and ground glass opacity in anterior, non-dependent portion, more typical in later stage. Lung cysts and bullae of varying size probably developed as a result of prolonged ventilation. CATscan findings of late stage or the survivors. Lung opacity open as anterior and posterior density gradient in lung, wider and posterior dependent portion. Bilateral symmetric, that is more common in extrapulmonary origin. Pulmonary origin are apt to be asymmetric. Ground glass opacity, nonspecific sign that reflects overall reduction of air in the affected lung. In acute ALDS, likely represent edema and protein within interstitial and alveolar space. Bronchiectasis within the GGO means the fibrosis. Mechanism of ALDS involves diffuse injury to the cells which form the barrier of microscopic air sacs of the lungs, surfactant dysfunction, activation of immune system, and dysfunction of the blood clotting system. In effect, ALDS impairs the lung's ability to exchange O2 and CO2. Symptoms and signs of the ALDS, often within 2 hours of inciting event, sometimes as long as 1 to 3 days. Major symptoms are short of breath, that is dyspnea. Second, fast breathing, that's tachypnea. And the others are muscle fatigue, general weakness, low blood pressure, dry hacking cough, and fever. Sir, you quit smoking? 2 thumbs up. Feliz Navidad. Congratulations. You have done the very best thing of all your life. Let's take a brief rest and enjoy the paintings of Pierre-Auguste Renoir in 1884, 170 centimeters in length, in Philadelphia Museum of Art. Name is Large Bathers. How do you feel? They are beautiful, so natural, healthy body, pleasant mood, obscene. I feel pleasant mood. Let's begin the museum tour. First case. On your left side, the chest AP supine film shows bilateral, diffuse, ground glass opacity or haziness of upper lobe dominancy. There is a central line to right atrium. That means he is in ICU and not in good condition. On your right side, CT shows the upper lobe of bilateral ground glass opacity of ALDS. Second case, the first image. On your left side, the CT axial thin section image shows bilateral diffuse ground glass opacity and posterior consolidation, which means gravity gradient. On your right side, on chest radiograph, this is AP supine portable view, central line, endotracheal tube, Levine tube, and bilateral diffuse haziness, ground glass opacity with air bronchogram. That's the first image. And what happened next? And day by day, his condition went bad to worse. And also his image findings went to bad and worse, from bad to worse. And finally, on the right side, we see only the black feature of large airway, no more black normal parenchyma, only white lung, white out images. He then next day passed away. This is the typical findings of COVID-19 pneumonia: bilateral, subpleural dominancy, ground glass opacity, and consolidations. We are quite familiar with these images. His course was also getting worse, from bad to worse, and became ARDS. Another usual findings of ARDS. On your left side, chest radiograph shows bilateral convalescent densities, and on your right side, CT shows bilateral diffuse ground glass opacity with bronchial dilatation showing some kind of fibrosis. Her final right side radiograph showed worse condition, more tubes, catheters, and whiter both lung, and traction bronchiectasis of fibrosis. This old woman was very bad from the beginning. Chest radiograph and CT shows bilateral extensive white lung with only few small black lungs. Severe condition. Then the image became white out, no more black lung to breathe. However, sometimes we see this kind of results, best results. She became almost normal after good treatment, became good condition. She was lucky and her doctor was very wonderful. Thank you, doctor. So lucky, so happy she recovered from ARDS. This right side CATscan shows how lucky, how healthy she is now. Sometimes ARDS can be better and cured. How do you feel now? You finished. Wonderful. Congratulations. And you also subscribed. Oh, so you are a gentleman. Thank you very much. And be healthy, happy, and wealthy. Thank you very much.